Welcome back. Today we have Caroline Pope in the studio. She is an animal communicator and therapist, and today we are going to be demystifying animal craniosacral therapy. Hello, Caroline.
Hello, it's good to be back.
Yes. Now tell me, can you explain what animal craniosacral therapy is?
Pretty much the same as human craniosacral therapy. A lot of people will know it as CST for short. Derived from osteopathy. It's a very hands-on therapy, but literally the most pressure you're putting on is that of a 5-cent piece. So it's much more allowing the body what it needs to do rather than trying to force the body, because what a therapist thinks a body needs to do versus what the body knows it needs to do can kind of be a bit like the Montagues and the Capulets, really. So it's very gentle and it's releasing restrictions, allowing the cranial rhythm to re-establish a correct path, and the animals benefit greatly from it. Yeah, so the most pressure I'm putting on is literally that of a 5-cent piece. And I often say to my clients, it's like watching paint dry, because they're just sitting and the dog or cat may close its eyes, it may lay down. You're not seeing much. But what's actually going on internally, there's a lot of recalibrating, and it's really, really big. If you ever have a CST yourself, you're going to feel a difference. And that's why I actually collaborate with a vet, because she will bounce information to me, or I will say to her, "Yeah, not quite sure about X or Y, can you please check that out?" Because no one person can fix everything. And often if I'm feeling restrictions, say for example in the spine, everything runs off the spine. So the moment the animal's movement is compromised, so is its digestion, its elimination. Dog may well be having heart problems, for example. All the nerves for the heart innervate out of the parietal bone and go down through the thoracic. So if your dog's got problems in its thoracic area or the parietal bone's jammed, that makes a huge difference to what the dog's heart is doing, and its medication may need to be adjusted. Everything interreacts with everything else. It's the one body. We're past the days of saying, this is good for the heart. The fact that your liver's going to keel over in 6 months has got nothing to do with it. It's that integrative, holistic approach.
And how did you get into it and why?
Started with cranial for myself, because I had thyroid problems at the time and really, really bad migraines. And CST actually got rid of them. I was literally being injected every second day with really heavy duty stuff, didn't need anything. Because I'm me, I pushed my therapist to work on a horse I had at the time, and I'd had him for, I think, 6 years by that stage. Great horse, but he'd always been tetchy to put a bridle on. Deb released his temporals, which are temporal bones, which are basically releasing around the ears, and from that day on, I never had another issue with a bridle. And of course, that got my very instant and undivided attention. Started exploring it. Spoke to a few clients about it, but unfortunately I wasn't able to afford it at the time. Had a phone call one day, picked it up, and it was one of the clients. They'd banded together and went, "Right, you're going to owe us X amount of CSTs. There's a course coming up. This is where it is. We've paid for it. Off you go." So I was incredibly lucky. And from the first day, I was just hooked.
And can you explain exactly what it is you do?
Animal will come in. I also use a bioenergetic handheld device, because it speeds things up and it helps calm the animal, because no animal likes being on a table. I mean, obviously horses aren't going to go on a table. That's a little different. But most animals don't like heights in the same way I'm terrified of it. So it helps. And it's literally a hands-on therapy. I can start sometimes at the back end, other times I'll start with one hand under the chest or the neck or the head. It really depends on the individual animal and also where they're comfortable, because a lot of animals, particularly dogs, can be quite head shy, or if their neck's really sore, they're not going to want you putting hands on, and trust is earned. It's not given. And if a dog's got a really big problem, or any animal at one end, starting at the other builds up trust and releases the restrictions. So by the time you get to where the problem really is, they're not worried. And a lot of the time they'll literally lie down and just pass out, which is really nice.
And what sort of ailments do you treat?
Pretty much anything in the age bracket. Arthritis, stiffness, can help with a lot of dogs that start getting lack of proprioception and neurological as they get older. Vestibular disease in dogs and cats is a big one. Epilepsy, pretty much encephalitis, pretty much anything, because it improves health. It's no different to you. It's being proactive rather than reactive. And of course, the earlier you can get to something, if you can, it's the same as us. If you start treating whiplash within the first 48 hours with anti-inflammatories, your long-term prognosis is going to be quite different. If your dog's leapt off the beach wall and crashed onto the rocks or whatever, getting onto it in the first 24 to 72 hours, the dog's going to have a lot less issues than if you wait 6 months and all the compensatory patterns have built up. No different to us. You really need to be proactive, and long term it's cheaper too to be proactive rather than reactive. I say to people, change of seasons, but you may well find that your dog or cat needs 1 session a week if they're acute or it's been let go for a really long time for 4 or 5 weeks, and you may get down to 1 trip a month. But if you stretch it out to 6 weeks, you might be back to where you are. And it's not fair to our animal friends to leave them in pain when we can make some lifestyle adjustments and change the quality of life so very, very much. Because at the end of the day, quantity is great, don't get me wrong. We all want our animals to live to an old age. But if there's no quality, it's all irrelevant. And this is where holistic health and, in my case, craniosacral therapy makes such a difference. It's about the quality of life. And the more we can do to improve that, the happier everyone is.
And can you please give us some advice on how to have a healthy and happy animal?
Be proactive. I generally say every change of season, as they start to age from about the age of 6, possibly 4 with the larger dogs, because of course there's all that, the rate of aging. But just stuff like all your moodle-oodles and anything with hair under the pads, trim it back, because otherwise it's like you walking in socks instead of bare feet. They slide, they hurt themselves. Tiles, floating floor, timber laminate, polished floorboards, really bad for dogs and aged cats. I know they're a pain, but carpet runners are your best friend, and they can literally, in a lot of cases, be the difference between an animal being on painkillers and not, because every time they slide or scrabble, that's all we see. They experience a lot of pain. Just getting your flooring right, that's where your dog or cat spends 80 to 90% of their time. It makes a huge difference.
Okay, well, thank you so much for joining us today, Caroline. That was really interesting and very educational. For those interested in learning more about Caroline Pope and animal craniosacral therapy, please head to her webpage on our website, healthwellbeingandlifestyle.com.au, and hang around for after the break. We have another amazing guest.